This afternoon we have 4 presenters. Myself, Professor Tony Badrick, who is the CEO of the Royal College of Pathologists of Australasia Quality Assurance Programs. Luminita Antin, who is the Proficiency Team Leader from the National Measurement Institute. And Paul Ching, who is the National Quality Coordinator for SGS Australasia. Each one of us will be presenting different aspects about proficiency testing. We all agree that proficiency plays a very important role in relation to accredited testing, and therefore we're very passionate about the value that it brings. To start with, I would like to present a general overview of PT and outline its benefits. Proficiency testing evaluates the performance of individual laboratories for specific tests or measurements and is used to monitor continuing performance. PT involves the distribution of homogeneous and stable PT samples to participants who analyse them and report their measurement results to the PT program provider. The main objective of PT is to assist the participant in assessing the validity of its measurements. As such, it supplements the laboratory's own internal quality control procedures by providing an additional external audit of their testing capability. PT programs also test aspects of a laboratory's management system, such as the reception of samples, treatment of data, and result reporting. As such, proficiency testing provides objective evidence in the monitoring of a laboratory's competence by providing an independent assessment of overall performance. While participation in PT programs is sometimes seen as a necessity to satisfy accreditation bodies, there are many fundamental benefits for laboratories that participate. Laboratories as participants are the major stakeholders, but other stakeholders such as customers, professional bodies, and industry regulators also have interest in the performance of laboratories involved. Proficiency testing supports the reliability of accredited testing by providing a means for ensuring ongoing competence. Accredited testing represents the highest level of testing competence available and provides compliance to both mandatory and voluntary requirements. As such, good performance in a proficiency test provides independent evidence and hence reassurance to the laboratory and its clients that procedures, methods, and other laboratory operations are under control. For regulators and accreditation bodies, PT ensures competency and adherence to specific quality standards. It also provides documented evidence of a commitment to quality and compliance through a laboratory's ability to produce reliable and accurate results. For non-accredited laboratories, it assists in the pursuit of accreditation by testing their capabilities. The benefits of PT for laboratories go beyond just fulfilling accreditation requirements. When used appropriately, PT can reduce the laboratory's risk of producing incorrect results. The basic purpose of PT is to assess the performance of laboratories for specific tests and/or measurements. As an external assessment, it provides an opportunity to obtain an independent appraisal of laboratory data compared to reference values or to the performance of other laboratories. In very simple terms, PT is an essential tool for helping to ensure that your laboratory gets its results right. Proficiency testing is often the quickest and least expensive way to ensure that the results generated by a laboratory are correct. Satisfactory or successful participation results provide managers, staff, clients and regulators with the confidence that a laboratory's performance has been independently assessed as being competent. It enhances customer confidence through the reassurance that the laboratory has the expertise and resources to produce consistent testing outcomes. This strengthens the reputation of the laboratory and fosters trust, client satisfaction and loyalty. Unsatisfactory results in a PT program may indicate potential sources of error that require investigation. Participation therefore provides a valuable opportunity to implement corrections. This may involve the identification of discrepancies, biases, or areas for improvement in testing procedures, equipment, or staff training. This is extremely important as when left undetected, poor results may continue to be provided to clients and other stakeholders. In these instances, PT can be considered a vital tool for both risk management and quality improvement. By detecting early warning signs, corrective actions can be implemented. When a laboratory does not receive satisfactory results in a PT program, it provides an opportunity to investigate areas where its future testing could be improved. This might include the adoption of new or modified methods, a review of internal quality controls, or equipment modifications or replacement. PT can also provide a valuable educational element to the laboratory in relation to staff training by indicating its success or identifying areas where additional training is required. It provides an opportunity to compare operator capabilities within an organisation. PT also provides an opportunity to set performance goals, monitor progress over time, and track performance. In addition, the benefits of PT are enhanced by participation in programs which offer different types of materials, samples, and tests. PT also helps laboratories validate their analytical methods. For some laboratories, their participation in a PT program might be used to trial their performance using a new or irregular test or measurement. At other times, it may provide an opportunity to compare results using different concentration levels to those normally used by the laboratory. Through participation, laboratories can assess the accuracy and reliability of their testing techniques. It also provides an opportunity to benchmark performance relative to other laboratories worldwide. PT can be used to check measurement uncertainties, that is, the estimate of the accuracy that the laboratory claims to reach. When sufficient data is collected by participation in several PT programs, a laboratory can evaluate the general validity of its uncertainty statements. Another bonus of participation is that PT samples can be used as internal quality control materials. In programs where there is sufficient stable material provided, the unused material could be useful for internal quality control monitoring. The values assigned to the material or the consensus values may be useful for further internal quality control testing or operator training. Considering the frequency of participation in PT programs is very important. The minimum requirement for accredited laboratories is once every 2 years. However, there are benefits associated with more frequent participation. While a single participation offers information about the testing capability at a single point by a particular tester, more frequent participations enable laboratories to monitor their performance over time and identify patterns before they become problems. It is important to note that PT does not replace internal QC, but provides valuable information for improvement. In summary, successful performance in a proficiency testing program provides continued confidence in the reliability of accredited testing. However, it is very clear that the generated benefits to laboratories, management and staff remain, whether or not the laboratory needs to participate for accreditation purposes. Thank you. I'd now like to introduce Tony.
I'm going to talk about EQA or proficiency testing from a pathology organisation's point of view. I'm from the RCPAQAP and we provide an EQA service for Australian and indeed overseas pathology laboratories. A lot of what we do, I'm not sure how many people in the audience are involved with healthcare, a lot of what we do in terms of the samples that we send out, they're not quite the same as in other areas of testing. We often, the matrices that we use, blood, urine, faeces, are very messy. The materials we try and measure, there's often no standard. There's often no reference method. So we have to resort to other things to ensure that we get consistency of measurement. But there's still a long way to go. So I'm actually going to show you some problems that there are with pathology testing, really to emphasise how important EQA is, how important accreditation is, and just to let you know there's still a lot of work to go. So these are the sort of standard charts that I'm sure most laboratories would be used to, that come from a PT or EQA provider, and there's assessments there of how well you've gone compared with your peers, whether you've got linear methods, etc. So that's good. But what I think is important, particularly when you're dealing with healthcare and with patients, not that I don't think all EQA isn't important. Buildings will fall down or vehicles will stop, but healthcare is something that's very personal, I think, to us all. The samples that we send out to laboratories, and we send out thousands of samples every year, the samples we send out to laboratories are meant to be, they're in little bottles or they're on slides, and laboratories assess those to the best that they can, send back their results, and we assess them against their peers. But what I always say to people that I talk to is that these aren't bottles, these are effectively patients. So what we act as is a patient advocate. What we are interested in isn't EQA per se or accreditation per se, we're interested in patients. So these things aren't bottles, they're patients. It's the only way we can ensure that if a patient goes to this laboratory or that laboratory or that laboratory and gets a result and subsequently goes to a clinician for treatment or monitoring, that in fact they get the same treatment and monitoring based on that same result. Okay? So it's critical. It's critical to healthcare. It's the only way we can identify differences between different laboratories. And this isn't punitive, it's a quality improvement. And in our country, it's a critical quality improvement. I think many people in this room would be aware of the importance of traceability, where you have a chain, unbroken chain, from where you measure things in your laboratory back to an SI unit or sort of a reference material, a certified reference material that's measured on a certified process procedure or measurement procedure, so you know you've got a very high quality result. And then there's an unbroken chain of calibrators and lesser methods that eventually come up with a calibration that you use in your laboratory on your piece of equipment. With a lot of biological materials, a lot of things that we measure, a lot of hormones, a lot of peptides, a lot of tumour markers, there is no reference material because they're different in many humans and particularly in disease states. We just don't know often what it is that we're measuring terribly well. We don't have reference methods. We don't have mass spec or gravimetric methods. We have immunoassay methods which are very imprecise. So rather than having the full chain, our chain of traceability extends as far as the manufacturer. So we rely on the manufacturer to give us our target value on their equipment. What can go wrong with that? So in EQA, typically what you do is you assess yourself against your peers. And if you get the same result as your peers, and your peers are the people using the same instrumentation, the same reagent, the same method, if you get the same result as your peers, that's fantastic. If you don't have a full traceability chain, there can be problems, because you're relying on the manufacturers somehow are getting the same results on this material, which there's no reference material for, there's no reference method for. So this is a set of EQA results on a fairly common measure called ferritin, and ferritin is something that's used to measure both iron deficiency and low levels are associated with iron deficiency. It's basically the storage form of iron in your body, and iron overload. So too little iron deficiency, too much iron overload. It's the best assay that we've got. You can see here, you can see there, that's the set of results across two sets of EQA samples, and you can see there's quite a spread of results, really. We often have problems with matrices. As I said, this is a human sample, a pure human sample that's been collected from a patient. And you can see, obviously, there are two distributions. There are two distributions of results. In fact, there's three distributions. There's a low set, a medium set that get the right sort of results or get the same results as each other, and there's a high set. And you can see here that, in fact, these are from different manufacturers, all measuring the same thing, by the way. And you can see that, in fact, for the low value for ferritin, and this is where you're looking for iron deficiency, the low set of results from this manufacturer, same samples, don't actually even interact with the other manufacturer. Completely different results. And that's because there's no higher standard, there's no higher reference method. You can see the differences, okay? So patients would go to different laboratories using different equipment, get a different result for the same test. Does it matter? Well, in fact, the standard sort of clinical decision points are sort of almost set in stone. Less than 15 for iron deficiency, greater than 100 for ruling out iron deficiency. See these results? So there's a chance, depending what rule they use, this is the standard rule, go to a different laboratory and you will be diagnosed with or without iron deficiency. Same sample, nothing's changed. This is the importance of EQA. So what it shows also is that laboratories have to do more than just assume that they're getting if they get the same result as their peer group, everything's fine. They need to look further than that. They need to look at, well, how are my clinicians going to assess this result? I need to give them more information to do it properly. This leads to traceability. There's a problem in a lot of the things that we measure because there's no traceability. Hopefully one day there may be some way we can overcome that problem, but there's still a lot more that EQA can tell us rather than just you're getting the same results as your peers. It identifies problems. And here's a classic example of a problem because of this lack of traceability. So, to have traceability, you need certified reference materials, standard materials. We don't have those in many of our measurands in pathology. Reference measurement systems, we don't have those in lots of pathology. Network of reference measurement laboratories, we don't have those in pathology. Universal reference intervals, we don't really have those because all our methods are different. Trueness, EQA schemes, PT schemes, yes, that's what's the saviour. At least we know that we're not all getting the same result. And then laboratory quality systems, again, they're critical if we're going to improve the situation. Regulators and manufacturers, they're key in this. Thank you.
Thank you, Tony. Our next presenter is Lumi. I'd like you to welcome Lumi.
Hello, everyone. So I was going through the conference program, and I've noticed that we ask ourselves these 2 days lots of questions. What a reference material? A material component of a successful accreditation is not available. How I can be more certain around measurement uncertainty? Are our staff trained appropriately? How do we build trust through testing? What is the root cause of our non-conformance? Is our analytical method suited for intended use? And I've been to most of these presentations, and I've noticed a concept mentioned again and again and again, proficiency testing. And this is what is going to be my presentation about. So I'm going to talk about how to find the answers to all your questions in proficiency testing. So a reference material is a material component for successful accreditation. But it is well known that a common problem associated with reference materials is their availability. And a laboratory in its normal life have to analyze a large number of samples in a short amount of time. So they have in the same batch various matrices, wheat flour, tomato paste, celery puree, infant formula, to be analyzed for a wide variety of tests: total aluminium, chromium, copper, sodium, potassium. So there is always a challenge for a laboratory to check if the method performs well for every single test in every single matrix if a reference material, a matrix match reference material, is not available. So yes, proficiency testing is another tool that can be used by laboratories to check method performance. And to demonstrate that, I have a story for you today, a real life story. A laboratory, let's say a laboratory of number 13. They have 2 methods for measurement of total elements in food. One method involves both nitric acid and HCl. The other method involves only nitric acid. And because they don't have a matrix match reference material to check how the method performs for every single test in every single matrix, they just use the 2 methods randomly. Until one day when they participated in a proficiency testing study. This study consisted of a bovine liver sample and a wheat flower sample. And they use the same method for all tests in both matrices, and all of their results return satisfactory Z scores, except for chromium. The result reported by them for chromium in bovine liver was low, still satisfactory. The result reported by them in the wheat flour sample was too low and returned an unsatisfactory Z score. So they start asking themselves, why? What is the root cause of our non-conformance for only one single test in only one single matrix? And proficiency testing can be a starting point if an investigation is conducted. Just look for the patterns, because in proficiency testing, results from different methods are compared. So proficiency testing can give us a feedback on how our instrumental technique performs across every single test in every single matrix. So plots of participants' performance versus instrumental technique show no particular trends. However, Laboratory 13 noticed that all the unsatisfactory results were low, regardless of the instrumental technique used. And then something else. In proficiency testing, a laboratory is asked to use their normal method and to report the essential details of the method. And this is because trends, backed up by scientific evidence, can provide a valuable information on how our method performs. So when Laboratory 13 checked the results reported by the laboratories, they noticed that the two sets of results had a similar distribution, with all high results coming from the same group of laboratories. The laboratories who use a more aggressive digestion regime, high digestion temperature, a combination of nitric acid, and a high ratio sample size HCl. These results were also in good agreement with NMI information value and homogeneity value. And then if you look at the Codex Alimentarius recommendation for measurement of elemental impurities in food by ICP, says that digestion of the elements in food should be until extraction is completed. And it is well known that chromium is an element whose extraction is strongly dependent on the digestion regime, especially if the matrix has a high silica content, like our sample, the wheat flour sample. So for complete extraction, it is recommended to use an aggressive digestion regime, high digestion temperature, a combination of nitric acid, HCl, hydrofluoric acid. Laboratory 13 used only nitric acid, and this might explain the low results reported by this laboratory in both matrices. So something else. A laboratory should check how they perform satisfactory or not, should check their performance satisfactory or not over time in order to identify trends before trends become a pattern. So when they check their performance over time, they noticed that chromium result returned unsatisfactory Z score in two studies, 1417 and 1810. And when they checked to see what they did differently in these two instances of unsatisfactory Z score, they noticed that while in previous studies they used the method that involved both nitric acid and HCl, this time in these two studies they used nitric acid only. So this is another situation when rule-based mistakes happen. And these type of mistakes often takes place in a laboratory. And it is when an analyst encounters a familiar challenge, measurement elements in food, I've done it before, but applies an unsuitable method. Measurements of chromium only by nitric acid may not be suitable, especially if the matrix has a high silica content. Another situation here, different story, still a real-life story, is an example from a proficiency testing study, acid extractable in soil. It is when a laboratory reported using a dilution factor of 25 for all these elements in red. And when we check the results, we've noticed that the results reported by them exactly for these elements were higher than assigned value by exactly same factor, 1.2. So looking at the trends in proficiency testing, you can also identify preparation procedure mistakes, errors due to pipetting, calculation error, bad techniques in transferring solutions. So proficiency testing can also help us to be more certain around uncertainty. We can get a feedback on how realistic our uncertainty is by comparing our estimate of uncertainty with the other participants' estimates of uncertainty and with the uncertainty of the assigned value. And at the end of every single study, we receive a performance history report. And this one allows us to pick up trends, identify areas of improvement where an equipment has to be recalibrated, instrument has to be changed, staff maybe train more further, or we have to enhance the quality control measures. So in summary, whether you want to build trust through testing, check if your method is suitable for intended use, be more certain around measurement uncertainty. Remember, you can find all your answers to your questions in proficiency testing.
Thank you very much, Lumi. Our final presenter today to give a user perspective is Paul. Please put your hands together for Paul.
Thank you, Karen, for the introduction, and thank you, Tony and Lumi, for the glimpse of the importance of the technical aspects of a suitable and well-developed proficiency program. Now, let me take you on a different perspective on its importance in life science, focusing specifically more around asbestos at the end user, and the journey has taken me through my professional career and where it has taken me today. Through my professional journey over the past 15 years, I've been actively involved in analytical disciplines as well as in the consulting in the built environment. During this time, the role that I've held included consultants, analysts, technical facilitators, laboratory and quality managements. Within this period, the aided proficiency programs such as the NAP, or the National Asbestos Program provided by PTA, has played a vital role in the assurance as an individual, as a trainer, as a laboratory manager and quality manager, that the accredited laboratory upholds its confidence and confidence in the training of the staff and the reported results, which may have an adverse public health effect. As an analyst, samples provided in these programs is relevant and reflective in the real world and what analysts may encounter. For example, imported goods from some countries, less than 5% asbestos-containing material is deemed as asbestos-free. Here in Australia, we have zero tolerance before being imported into the country. Or what it is already in the surrounding can contain trace level asbestos which may not be detected by naked eyes. Through these types of samples, facilities can ensure their analysts is challenged to the real world, or to the relevant real world in a controlled environment. Receiving your package from PTAs can be a thrilling challenge. Like a student sitting in for exam, what did I score? What can I have missed? When the letter comes through with a satisfactory score, you know it's a testament to your analytical precisions, especially in the qualitative analysis, where meticulous attention to detail is paramount. Let's take it up to the next level. As a trainer, I've trained a number of technicians in my time. Proficiency programs serves as one point of validation, that the technical knowledge and analytical skills has been transmitted down to the next analysts, providing both the trainer and from an organisation perspective, the confidence it is in its staff to produce accurate results and the determination to uphold a high quality standards amongst its competitors. At a quality management perspective, it provides an independent evaluation of the staff's performance. Programs like the NEP, it's an individual participation basis. Brings a technical confidence and assurance in its technician's ability to meticulously analyse samples down to the trace levels to accurately evaluate the presence of asbestos or possible contamination. From a technical assessor perspective, the uniqueness of each facility's in-house developed training and proficiency and competency programs consistently reviewing the widely recognised NEF programs instill confidence in the facility's results and ensure that the staff is proficient in their analytical capabilities. Proficiency testing providers such as PTAs and its programs, it's pivotal in providing enhanced quality assurance, safety and reliability. Through innovation and emerging technologies, we find ourselves continuously striving for excellence in our fields. From an accredited facility with end users of such programs to another, or upcoming facilities, proficiency testing program enhances quality assurance and benchmarking standards for facilities uphold. PTA and proficiency providers alike have been instrumental in providing confidence and assurance in the various roles along my professional journey, as it has been for many individuals and other companies alike. I thank you today for your participation and listening to my speech and the panel.
Thank you very much, Paul, and thank you to all our presenters, and thank you to everyone for being here to listen. We can probably have time for a couple of questions. I do have one here, which is about, I guess, the frequency of participating in proficiency tests, and I guess depending on the program or the area of testing, what would be considered annually an appropriate number of programs to participate in?
Is this a question for a PT provider or a laboratory?
I guess it's, well, I guess maybe Paul, talking from an asbestos point of view, you were talking about individual counters participating. How often would you participate as an individual counter?
It changes depending on the risk. As we all discussed through this whole conference today, is about risk, the approach of risk and how we evaluate risk. So from my experience, at least from the last 15 odd years, if an analyst has probably a lower scoring consistently, so you may want to enroll them in more frequency, or you have a different approach, especially when you do change techniques or different methodologies, you might want to participate a little bit more frequent, just to instill that confidence in what you're providing as results from proficiency providers, any providers in general.
Yeah, thanks, Paul. And another question is about selecting appropriate PT programs. Lumi, did you want to have any comment about that?
That's very, very important. So when you select a PT provider, first of all, check, would be good to be accredited to ISO 17043. You have to check if he's suitable to what you do, if he's in the right metrics, it has the right tests, if the analytes are the right concentration level. You also have to be a little bit aware of the statistics involved. What is the acceptance criteria? What makes that result satisfactory or not? So these are the main things I think the laboratory should take in consideration. So when they take in consideration the acceptance criteria, they have to be aware of the regulatory requirements. They have to take in consideration their client requirements, because they have to assess their results against these requirements if the methods they use are producing satisfactory results in accordance with their clients' requirements.
I think it's all about risk. And to me, as an EQA provider, our role is to help our clients, our customers, identify risks that they might not be aware of. So we try and make the material, or we get the material, such that it might be things that they don't often see. We're involved with toxicology screening, for community screening for drugs of abuse, and often laboratories don't know what the next drug on the street is, and we're often 12 months behind. or they might not know what the next masking agent might be. So we will send out samples that, as far as we're aware, and the people that we work with, they're the most recent drugs that are out there at the right concentrations with the right masking agents. Similarly, with new hormones that are detected, or new tumour markers, or new tumours, or tumours where there's been shown difficulty in diagnosing those tumours, we send out more of those. So our role, as I say, our role should be, and is, we hope, to help laboratories identify risks that they wouldn't normally know. You don't know if you're misdiagnosing patients until there's a catastrophe. So we need to assist them by giving them hard cases or unusual cases so that they are aware that they can detect these cases. So it's about risk, but that's what I see risk about. Risk in terms of failure to detect.
Thank you, Tony. Another question we have is, how are analytes and matrices chosen for studies?
From a asbestos point of view, we need to be relevant to the real world. So, in asbestos in its entirety is something close to 30,000 different products, and is still widely available in some countries as a mining component. So we have to make sure what gets imported through border forces, brake pads, gaskets and so forth is included into the proficiency program, just to make sure that we are able to detect such a low level or a unique one that we don't often come by, especially for asbestos in Australia. We regulate 3 of the 6 forms, so you might not necessarily be able to detect or have the confidence in detecting the remaining 3. Yeah, so choosing the right matrix in the program is actually really important.
True, thanks. Thanks, Paul. Another question is, what are the emerging trends in proficiency testing? And the hot topic of the last couple of days is around AI, and is AI impacting these trends?
Yes, in my field it is. There's a lot of digital pathology going on out there now. So when slides come in that are prepared from a bit of tissue that's come out or off somebody, the tissue might be stained or will be stained, and they might look for particular markers in the tissue that indicate a cancer. Often those markers are in cells themselves, so they look at the cells and they see how many of these positive markers are in cells. A lot of that counting is moving towards being done digitally, and the whole slide, the whole cellular structure is being sort of digitised, and then machine learning techniques are used to identify abnormal cells. So it's certainly being used diagnostically now more and more. We need to provide programs that provide a sample where, again, we know what they should see, what the machine learning techniques should see, and we should challenge those systems. It's never been used just by itself, so don't get worried. It's always used as a sort of a companion to the diagnostician, but it's becoming more and more available, certainly in radiology as well.
Another question is around how can the quality of samples be assured in PT programs?
I suppose you cannot provide a PT if the sample is not sufficient, stable and homogeneous. And of course there is no such a thing like a sample which is perfectly homogeneous or perfectly stable, but you have to ensure that inhomogeneity in a sample or the instability which is in a sample, the slightly changes you would notice that do not affect participants' performance. So if you see a variation in their performance, you have to make sure that that one is coming from their analysis and is not coming from sample inhomogeneity and instability, or from the poor quality of a PT sample. And each time when you run a new program, you must ensure that the method you are used has to produce homogeneous and stable samples. So there are thorough tests which are conducted and run to ensure this. And then if you can prove that your method can produce stable and homogeneous results, then and you don't change that preparation method, then you can ensure that the samples produced exactly with that method through the same procedure are of the required quality. whenever you have chance. However, you still have to check your preparation procedure time to time.
Thanks, Lumi. Another question, can you do proficiency testing for qualitative testing, example, visual examinations?
I think
Tony?
Yes, we do all the time. We send out samples that are positive or slightly negative. We send those out because there's a lot of slide tests. I mean, everybody here probably has done a COVID test. So labs use those sort of tests routinely. So we provide tests, we provide EQA material that tests really the grey zone between positive and not. That's critically important.
Thank you. Paul, I don't know if you're able to answer this one about how do you go about ensuring all staff in a lab are able to participate in an appropriate proficiency program?
So it depends on the program, depending obviously the test that needed to perform. Asbestos is probably, like I said, the dominant one that I've done more exposure to. It's training staff. Your first presentations of your PT samples would be the analyst who is participating. So the asbestos SNAP program is individual basis. So your analyst is enrolled in every round or however we deem suitable. For chemistry ones, it is a little bit harder, but it's more about the comparative reproducibility of your results and how your analysts actually be able to perform. As Lumi and Tony's expressed before, it's about your analysts being able to produce consistently across that test within the facility. So you can, some samples are adequate enough to maybe 2 or 3 analysts be able to provide or participate together. So you do have programs, some testing I've seen where you might have 4 analysts participating within the round, and it's not a consensus result, but you're scored individually.
Sure, great, thank you. Well, that brings us to the end of our session on proficiency testing. I'd like to thank Paul, Lumi and Tony for their input today, and I hope everyone's enjoyed it. And thank you for being part of today's session.